Education is the most powerful weapon which you can use to change the world. When Nelson Mandela stated this quote, he implied a person needs to guard themselves with the wealth of knowledge in order to accomplish a task. The role of nursing as we know it has evolved, from Florence Nightingale, the mother of nursing, to Hippocrates, who's also known as the father of nursing. The ways that people are thinking should change as well. The need for nurses to advance to a higher level of thinking is drastically needed. Baby boomers are retiring, rural areas have limited access to healthcare, and laws are constantly changing. In 1965, Dr. Loretta Ford partnered with Dr. Henry Silver, established the first nurse practitioner program at the University of Colorado. They went through strenuous efforts to make the role of nurse practitioner independent. Healthcare providers, along with entry-level students, need to be aware of the barriers that they face if they want to potentially become a nurse practitioner in the US. The three issues I would like to discuss with you today are: nurse practitioners are not seen as competent because some people believe they don't have the same level of education as an MD. Second, nurse practitioners are not allowed to practice at a primary care level in some states. Third, these two factors are contributing to the healthcare shortage that we're dealing with today. Nurse practitioners and doctors do have a compared amount of training. Doctors, when they go to medical school, go through 4 years of medical school and possibly 4 or 5 years of residency, depending on their specialty. Some may even take an additional year, which some states call a fellowship. Nurse practitioners, before a nurse can become a nurse practitioner, they have to be a nurse for 2 years. And within those 2 years, then they're eligible to apply to a nurse practitioner program. Once they're in the program, the nurse practitioner program is about 3 to 4 years, at which then after they're eligible to sit for their boards. Some may argue that nurse practitioners have more clinical training, while medical doctors have more research-based training. The fact of the matter is, nurse practitioners do go through an extensive amount of training and they are competent to practice. On to my second point. Nurse practitioners are being prohibited in some states to practice independently. For an example, in Florida, if a patient comes to the clinic with a chronic cough, the nurse practitioner, obviously, they assess them, they take the history, they do all the shish kebab. Once they realize that they want to prescribe a medication that contains a narcotic, they will then have to refer them to a doctor who is able to prescribe that narcotic. I don't know about you, but this compromises the continuity of healthcare because the patient will then have to wait and their health may get worse and worse and worse. However, what really doesn't make sense is, in this very same state, nurse practitioners can prescribe potassium drips. Now, a potassium drip, if not prescribed adequately, has the ability to give a person a heart attack. If there's too much or if there's too little, this can kill someone in less than 30 minutes. This is a nice little IV pole that I have here. Thirdly, these two factors contribute to the healthcare shortage that we face today. According to the American Medical College, it estimates 46,000 primary care physicians to be short in 2025. Nurse practitioners can easily fill that void. However, because of the strict archaic rules that Florida, California, and South Carolina have about nurse practitioners having to practice under a medical doctor, nurse practitioners cannot fill that void. In conclusion, the role of nurse practitioner needs to change. The American government needs to recognize that nurse practitioners have the training to be able to practice independently. These rural areas that are lacking in adequate health care will not suffer, as well as the common good. Doctors will then be less overwhelmed, and people in public will be less compromised. Let's share the responsibility, everyone. Thank you.